All right, I think we can start now. So, hi everyone, good evening. I hope you all are doing well. And it's been quite some time that I have not come live on Instagram. And I'm really glad to be here again with you people. So, today is a World Hepatitis Day. It's observed on 28th of July to honor Dr. Baruch Blumberg on his birthday, who discovered hepatitis B and who also developed hepatitis vaccine. So this day is observed to spread awareness about hepatitis among the public. So first of all, hepatitis is inflammation of liver. It can be due to systemic infection by some hepatitis virus, due to alcohol intake, due to some drugs, or due to some autoimmune condition. But hepatitis is mostly caused by hepatitis virus, which are namely like hepatitis A virus, hepatitis B virus, hepatitis C virus, hepatitis D virus, and hepatitis E virus. So these are 5 viruses which are found to cause hepatitis in human body. According to World Health Organization, every 30 seconds, one person dies because of hepatitis or its related illness. 1.1 million people die every year due to hepatitis. 3 million new infections occur every year. So hepatitis is a disease which has a huge burden for the healthcare as well as for public. And there is very less awareness among the public about hepatitis. So the World Hepatitis Day is very significant. Viral hepatitis, as I said earlier, are caused by the 5 types of the hepatitis virus. And among these, hepatitis A and hepatitis E are spread mostly by the fecal oral route, that is by contaminated food or water. Whereas hepatitis B, hepatitis C, and hepatitis D are transmitted parenterally by body fluid or blood, like blood transfusion, sexual intercourse, drug abuse, then the needle prick injury, etc. So, and these hepatitis B, C, and D normally cause chronic infection. You won't even know that you get this hepatitis because they usually manifest the symptoms even when it's very late, when the disease has already progressed. And that's why these 3, especially the hepatitis B and C, are very dangerous because normally people don't know when they have it, this infection. When a person has this chronic infection of either hepatitis B or C, then there's a chance of developing liver cirrhosis and liver cancer. Now I'll try to explain you what can be the symptoms, what can be the signs of hepatitis. Initially, in the acute phase, a person or the patient will have fever, body ache, then nausea, vomiting, abdominal pain, sometimes diarrhea, and jaundice, that is yellowish discoloration of skin. So normally public and you people might be knowing jaundice but not hepatitis. But jaundice can be due to many other diseases, and hepatitis is one of the main cause of jaundice. So these are the few symptoms of hepatitis. And a person with hepatitis A and hepatitis E, which is mostly transmitted by the fecal oral route, that is contaminated food or the drinking water, these hepatitis A and E can spontaneously recover. The person can spontaneously recover after few days or the weeks, and hardly it doesn't progress to chronic infection. But in some patients, in some cases, hepatitis A or the E can cause acute liver failure, which is very dangerous, and the person may have to undergo liver transplant if the person has acute liver failure. So now let's come to the treatment part. What do we do when we know that we have hepatitis? First of all, we should consult our doctor, visit a hospital. So there is symptomatic treatment and care available for the hepatitis A and E. Whereas hepatitis B and C, we have the antiviral drug which can be given to treat this type of hepatitis. So still it's a very serious disease and infection. So early diagnosis is one of the very important steps so that this infection can be treated in time, so that it doesn't progress to a very chronic infection which can cause liver cirrhosis and liver cancer. Then prevention, as we all know, that the prevention is better than cure, and it's especially very significant for hepatitis. So for the prevention, there are a few things that we can do. First of all is the hygienic food and drinking water. Secondly, safe blood transfusion, that whenever you get a blood transfusion, then you make sure that you get the blood from a certified blood bank, because the hepatitis B, C, and D can be transmitted during blood transfusion. Safe sex practice, like use of condoms and other protective measures, because hepatitis B and C can be transmitted sexually. Then vaccination. Vaccination is one of the very important steps towards prevention of hepatitis. So we have a vaccine for hepatitis A and B. Vaccine for the hepatitis B is given at birth. Then hepatitis A vaccine is given after 1 year of age. So these two can be prevented by taking vaccines. And one of the important preventive measures that we should know is that drug abuse and sharing of syringes. That nowadays we have this enormous problem of drug abuse in our society, that especially the adolescents and young adults are engaged in the drug abuse and use. So the sharing of the syringes or contaminated syringes can spread hepatitis B and C. So we have to be very careful, and we as a citizen of the society need to spread awareness. Our parents, our teachers in the school, and family members have to be very careful of their children and need to share the awareness and importance of these preventive measures. Well, these are all about hepatitis on World Hepatitis Day. I know that due to COVID-19, there is less focus on all other diseases, and especially other infectious diseases, but we have to be well aware, and we cannot delay in getting treatment or getting diagnosed all these very important and serious infections like hepatitis. All right, so thank you so much everyone for joining. We'll see you again next time with a new topic some other day. Take care of your health. See you all again.